Sisters chatting with each other, getting to know one another, talking about issues that we're all facing, good, bad, indifferent. Let's talk about it from one sister to another. Let's talk about it.
Hey, hey. Good evening, everyone, and welcome to the show. My sister is here somewhere. It says she's audio only.
Hey, having a little technical difficulties. I hope you can hear me. But we're going to get this right tonight. Here I come. Hey.
That's usually me with the technical difficulties.
Let me say, look, full transparency, people. I went to the eye doctor today and they did some stuff to me. I'm like, what? What's happening? Woo! So, yeah, we'll talk about that after the show.
Hey, it's been that kind of a day.
It's been that kind of day, but it's been an awesome day.
Busy.
I tell you, God is good and he's worthy to be praised.
Yes, he is.
It's good to see you, my sister friend.
You too. It feels like it's been a long time.
I know, but you know
it's
what?
Only 30 days, but gee.
Right.
It just feels like it's been quite some time. It's so good to see you.
It's good to see you as well. My favorite color on. Yes. Wear that purple. Yes. I love it. And I'm super excited, even more so for our guest tonight. You know, they agreed to come back.
I know, I'm so glad.
Oh my God.
Last month was just awesome.
Listen,
audience, if you weren't with us last month, go back and listen to it. It was serious conversation. It was an awesome conversation. A lot of information too.
That's so true, Wanda. That's so true. So we one of the things that I really am grateful for is having sister friends, because like we said in the first part of this series on mental health, is that we have to check on each other every now and then.
Absolutely.
We have to be able to not just check on people, also be transparent ourselves with ourselves first and foremost, and know when we need help, when we have burnt out, or whether it's just we're going through something and we just need help. So the topic that we have been discussing these last 3 sessions has been just really a big help, not just for me, but people I've been talking to. They've been saying, wow, thank you for sending that link to me. Thank you for sharing that. I couldn't see it live, but thank you, that kind of thing. So it's been great. So, we want to thank our audience for being here with us on tonight. You have been a great audience. Thank you so much for those who are chiming in. I see Elder Mia, I see Lady India. Thank you so much. Those who they're coming in. Thank you so much. We really appreciate you on tonight for joining us.
And be prepared to hold on.
Yes.
Because it's going to be good.
It's going to be good. So let's bring our guests in. We're going to just let them come on in, introduce themselves on tonight, because we want to get started on these questions that have come in since last month. So come on, let's bring them on in. Our I see it's doing it again.
Right, she went out again.
It's all right. I'm Carolyn, Cottle. God bless you both. Thank you for tuning in. Thanks for being our guest on today. We appreciate you so much.
So glad to have you back with us.
Glad to be here.
Yes.
Just open up and just tell us just a little about you, so our audience will know who you are. For those who are joining us, we have a lot of first timers on tonight. So just tell us who you are, what you do, where you're located, all that stuff.
Well, I am Jessica Bullock. I'm the CEO and founder of Life Options Counseling Services, and we have served thousands of families over the past 12 years. This year marks 12 years. I'm also a part-time professor, and I enjoy supervising other counselors and consulting with churches to bridge the gap between theology, and psychology. So again, I'm Jessica Bullock, and I'm so glad to be here with Sister Trend again.
Amen. Thank you.
Hi, I'm Carolyn Davis Cottle. I'm a licensed clinical social worker in New Jersey. My business is called Inner Image. I'm the founder and CEO. Inner Image was established 10 years ago, 2013. I've been a social worker since 1986. Ooh, did I date myself? So right. I've been around. I retired from the public school system, Newark Public School System, where I was a social worker in my last 15 years there. I am adamant about mental health and empowering people to be healthy and to walk in our purpose. That's what I do.
Nice. Well, see, we have the professionals here tonight, Wanda, right? We have our experts
Right.
here. It's not us. These are the ones you want to talk to, right?
Most definitely.
Yes. These are the ones you want to talk to.
Schedule your appointment.
Yes. Wanda, you want to get us started?
Yeah, so first, ladies, we have to say this again. We so enjoyed you last month and the conversation and the topics and all the nuggets that you dropped on us. And you dropped a lot of nuggets. So we wanted to kind of pick up where we left off with some of the questions that we have for you. And so we want to start with this question. What are some of the behind the scenes or hidden struggles families encounter during dealing with mental illness? And what steps should someone take if a family member is showing signs of mental illness?
Well, I guess I'll jump in. When I think about a family and the way in which they think about physical injuries,
Exactly.
they'll jump straight to, we got to get them to the hospital. We don't know what's happening. And many times they are quick to find a doctor, find a specialist, whatever needs to be done in order to make sure that that person is well. The same panic can occur, but the problem is that no one really knows how to help that person because it's not normalized or they haven't had conversations in the family about what to do if somebody has a mental health issue or something going wrong. From the time we're children, we're taught 911. We're taught about addressing physical injuries, but most times you see families frantic. They feel like helpless because they can't help, and you start to see them try to cover and shield that person because they don't want anyone else to know because they might be embarrassed because they don't really understand what's happening. So that's typically what I have seen.
And I'm going to piggyback off that. I think that we need to make these kinds of conversations normal because if we talk about mental illness like any other illness, there's some things that we could talk about in the Black community and nobody thinks secondly, oh, I got a little sugar. My blood pressure is high. What else? So they're just ailments. Arthur got me today. They're just ailments that we normalize, and it's okay to have those. And if we don't start talking about being burnt out, we work hard, and the microaggression is real, and the stress and the trauma that we normalize. When you read 3 boys got shot, or school was closed down, or the school had to go on lockdown, we think that's just like, oh man, that's terrible. And we keep it moving. That is trauma. So if we start to normalize the fact that we live in a traumatic society and we're going to have some ambitions that will cause us to need some help and somebody to talk to, then we can talk to families. I've noticed you've been quiet. I noticed you've been staying in your room. Maybe we should find somebody to talk to. And don't make it so scary, spooky, and taboo. Like you got to go talk to some crazy man over there in the corner that's going to say, That's not what we do. You see us, these ladies, we don't look like that, and we talk. Right. So if you have a teenager who's acting different and you notice that, look it up. Find some help. Just like you would look like Sister said about sports doctors or, emergency rooms. There's help. And I sent a little list of resources that I hope you guys can post so parents will know that there's help for your children and adults. There's help. We can find help. So don't suffer alone. And something is one of the questions said, if the family member doesn't know, you may not know what it is, but you know you feel different.
Mhm.
You know you feel different. You know if your stomach's been bothering you and it's been bothering you for more than a couple of days and you tried the home remedies and it's still bothering you know something's wrong.
Yeah.
So if something is bothering you and you can't shake it and you've prayed about it and it can't, seek some help. And it's okay to seek help.
You know, one of the things that both
Oh,
of
go
you
ahead.
said. Oh, go ahead.
No, I was
Oh,
going to piggyback because a lot of times people might not want to go to therapy because they don't understand the language and
Right.
the verbiage. But one of the beautiful things about going to therapy is we can help give you language to use to describe what you're feeling. So you
Right.
might not know what's happening. So the pit in your stomach when that person coughs, or interrupted sleep patterns during the night, we can help you to articulate what that sounds like on the mental health end. So you don't have to have it all together to get to therapy. It's almost like the person who cleans their house before the maid comes.
Yeah.
You have to clean the house. Let us help you clean it up. Let us see
Yeah.
the picture of what's happening.
Right. Right. That's good.
Get all out.
but and that kind of ties into what I was going to say, because that is so absolutely true. And I think 90% of the people who have cleaning help do that, clean up before the cleaning service. What's the purpose of paying them if you?
What's the purpose? I'm not doing it.
But you know, it's something that you both mentioned about the topic being so taboo that people either don't know how to acknowledge it or don't want to acknowledge it. How do we get people past that embarrassment, that shame, that I guess, and one of the things you said, Carolyn, was that normalize it. But how do we normalize something that people are so standoffish about?
I say change the verbiage. If you say mental health, as soon as you say mental, I'm not mental, I'm not crazy. Let's talk about emotional wellness. Everybody wants to do wellness. So let's do a wellness check. Emotionally, how are you? If you're kicking the dog, like when I do a workshop, I have this screen that I use and it says fine. Somebody says, how are you today? I'm fine. But underneath that, you're so full of anxiety. You're kicking the dog. You got road rage. You want to cuss out your husband. You want to throw your old aging parents out the window. You want to shoot your boss. No, you're not fine. You're masking all of those things that are going on the inside. You're not fine. And when I say normalize it, if I have a headache, how are you today? I'm good, but my head hurts. Really? Did you A, B, C, or D? If your children come to you and say you got a headache, the first my kids will be like, "Mom, really?" First thing I would say to them is, "Did you poop today?" Because we know if you eliminate waste, if you don't eliminate waste, it's going to show up somewhere in your body. Did you drink
That's
some
true.
water today?
That is absolutely true.
So we know the check-ins to make ourselves to do the assessment to see like this is bigger than me. I need some help. So if we just change the verbiage, mental health is what it is. They are clinical terms. It is a science. It is a wonderful profession. We studied hard, long. I got the student loan still to prove it. So we did our due diligence. But if I'm talking to you in clinical terms, that means nothing to you. But if I talk to you in everyday terms, whereby you feel comfortable talking to me, and I say, "How are you? How did you sleep? How are you eating? How are you reacting to? Did you hear what happened in the news the other day? So how'd you feel about that?" If you start having those general conversations with people, people will start to check in and say, like, wait, I'm not sleeping well. Or I'm not, maybe I do need to get some help. And that's how we can normalize. Take away the big scary terms, talk about it in everyday terms.
Yeah.
Don't tell your people they're crazy. Throw crazy out the only use crazy in comedy. Girl, you crazy, making me laugh like that. Take those negative terms out and
Right.
talk about it in the affirmative.
And Carolyn, just to piggyback off of that, when I think about counseling, people have gone to counseling before, but they don't want to say it. I would encourage people who have gone to counseling to make it a normal part of conversation and share your experience.
Yes.
So if I'm talking to a client or I'm talking to people and say, listen, counseling saved my marriage, counseling saved my life. Well, it didn't save my life, but it helped me to realize and put things in the perspective.
Right.
You were like, well, you seem like you got it all together. You went to counseling?
Yeah.
Yes, I went to
I
counseling.
sure did.
I went to counseling, and that's why I'm in the position I'm in today. Healthy.
I was going to say, how can we help somebody if we haven't helped ourselves?
And how
Or are not helping
First,
ourselves?
yeah.
So we have to normalize not only the words we use, but also the fact that there are Black folk and white folk, all kinds of folk out here going to counseling. So start sharing it. We overcome by our testimony. You might help somebody else
That's so
who
true.
has had barriers to thinking like, oh my gosh, only crazy people go. But no, she seemed like she got it together. She's going. So share your experience. That's normalizing it in our community as well.
It is. And you can talk about if you found somebody good. If you got a good doctor, you're going to talk about your doctor to, oh, well, my doctor is the best because they prescribed or I went with and now I am. Talk about it. And you don't have to get all in, you can share as much as you're comfortable with sharing. And don't be stuck on the diagnoses. That's another thing. I get people coming in and saying, well, my anxiety, well, you not suffer from anxiety. How you know? Who said? Well, because I X, Y, Z. Okay, so that may be that you're anxious, but do you need to be diagnosed with anxiety? Like let leave it to the expert. Your knee hurts. You're not gonna say, "Oh, I tore my what's the thing in your knee?"
Your Achilles.
Right, but that's in your ankle. I was getting ready to say.
Oh, that's your wait. We're gonna get
tendon. Patella tendon.
All right, you got cancer, but I can't diagnose that. I have to go to a specialist to tell me if that's what it is, right?
Right.
So if we would just go, not be afraid. That's the thing. Lay down that fear. Lay down that fear. And if things don't feel right on the inside, go. And guess what? The first one you meet may not be the right one for you.
That's true.
And that's fine. Go until you find the right one. Keep looking. And when you find a good match, you're going to see you ain't crazy. You just needed somebody to talk to. You needed some help. And if we do it, if we normalize it, make it just so that it's not a sin.
Yeah. That's huge right there. You ladies are saying some awesome things. And because one, like you said, normalize again the language, the terms we use. And I know we're kind of skipping around on some of the questions that people sent in and some of the questions we already had.
But they're hitting the points.
They're hitting the points because that leads into the other question that came up from our audience talking about those terms. There are terms that are being used like they want to be corrected. So I thought that was great. People really want to be corrected. They don't want to continue to say things like, they're crazy. And I one of the words that really bothers me when I hear people say it, the R word. You got many. You probably know, I don't want to say it, but you know what I'm talking about.
Yeah.
When they say those kind of words, and so help us today with those kind of terms. What other things can we say? I know you said like we taking out the illness part and saying mental health, or just saying take care of your health. That includes your head. That includes your emotions. That includes your feelings.
Emotional wellness.
Your emotional health. Your emotional wellness. That's where we start.
Yeah.
Because we'll take care of our physical wellness. We go get out and we'll take care of our outer appearance. But we have not been taught, nor have we had the luxury to worry about what's on the inside. Because if you just trying to keep your head above water, I had a friend say one time, Black woman, single mom, she said, I didn't have the luxury of having a nervous breakdown. Who was going to pay my rent? Like, who's going to feed my kids? So I might have had a nervous breakdown, but I didn't have the luxury of taking those
admitting it and taking care of it, right?
Or taking that respite in a hospital somewhere, in a retreat home somewhere, trying to recoup. I had to still work and keep it moving.
But Carolyn and Jessica, on that point, so if someone says, like someone come to you and say, oh, he's just, crazy, he's just the R word, he's just this, how do you respond to that? How do you correct that?
So sometimes it depends on how it comes. If it comes like, well, he's just crazy. Well, how you know? What makes him crazy? Because he always X, Y, and Z. So is he different? Because again, there's a lot of misdiagnosis going on. So if you have somebody who's on the autism spectrum, people automatically think they have some mental illness. They don't.
Right. Right.
That's a
Right.
functioning situation.
Yeah, that's
But
good right there.
if your thyroid levels get too low,
Mm-hmm.
and you know Hashimoto disease lives in these brown bodies, right?
Mhm.
But we don't get diagnosed. But if it gets too low, then you can have a behavior that is typical of someone who is suffering from some schizophrenia
Yeah.
or some kind of a mood disorder. But all it is a hormonal imbalance.
Right.
So
Same thing with diabetes.
right. So when you
Sugar
start
get
talking
low, they
about,
start acting a little different.
because it's a hormonal imbalance.
Right.
So when
So is us
typically
in menopause.
It's a hormonal imbalance. So when we talk about mental health or emotional health, we can talk, it's a hormonal imbalance.
Right.
So if you have to have medication, you have the medication to help balance out your hormones or your levels of whatever it's treating.
Mm-hmm.
So I like to talk to people in terms like that. Like
Yeah.
I'm not getting scientific and all because I
Right.
mean we can talk about that, but for what? What good is it? I went to the doctor. He said, "This is your." I can't even tell you what it was, but he said it's not supposed to be like that. Okay, how we fixing it?
Right.
That's what I needed to know. He said we're going to do
Right.
X, Y, Z. You do A, B, and C. It's better.
Right.
So that's where I am. Like I don't want to become the specialist in your arena, and I don't want you to try to become the specialist in my arena, but I want you to become the specialist in caring for yourself.
Mm. Yeah. That's
You
good.
know, I think it's a great opportunity when people come up to you and they use the wrong words. I use it as a teaching moment because one of the things that we should do is practice empathy and be kind.
Mhm.
I think that a lot of people use words that are unkind and can be harmful when you use those words. And so just saying, hey, you know what? I
Yeah.
know you know that term as that, but there's another term that we can use in order to be kind to someone who may be really struggling with X, Y, and Z because
Yeah.
it's what it really looks like. Or this is another word you can use for it. I use that with my children. So if somebody comes to me with the wrong information or a wrong term, I take it as an opportunity to give them other verbiage to use or to say,
Mhm.
hey, there's a community that would be really offensive. I'm very direct about that only because I would hate for someone I know to go into another realm and use a word that would be highly offensive and they just didn't know better. So if there's any ignorance that comes into my space regarding using certain words, I'm very quick and direct with that just to help them out because there is a better way.
Mhm. Yeah. Yeah.
Absolutely.
And we have to be careful with labeling because that's why people are afraid to go. They don't want to have the label of.
Mhm.
You know, again, some labels are acceptable. If I say I'm diabetic, you say okay. If I say I had hypertension, okay. If I say I had thyroid issues, okay. Arthritis, okay. You know, I suffer from depression. Ooh, ooh. Why can't that be okay?
Right.
Right.
Especially if it's managed. So we need
That's so
to.
true because there's still a lot of I don't know the word I want to use, but the stereotype type when
Yeah.
it comes to those types of diagnoses. Like when
That's
you find
true.
out somebody's bipolar or if they're
Right.
schizophrenic, any of those things.
Mhm.
Yeah.
People have a reaction to it
Right.
versus, as you said, being okay with it.
Yeah. Yeah. I wanted to just share some of the comments tonight. One, we want to first and foremost remind people, please do share. There's other sister friends that need to hear this one tonight. Let's not be stingy tonight. Let's share with our sister friends. So please go ahead and put your comments in and share. We thank you. Elder Mia said, no shame in counseling.
No shame.
Right. Kimberly said, therapy is needed for most. Right. You know, don't need to feel, indifferent about that. So we have to really remember that, like you said, emotional health. And Lady India mentioned about the water. She was saying how she feels so much better and how important it is for water in your body. Adding, she adds fruit to her water and things like that. So we appreciate your comments. Please keep bringing them, your comments and your questions. Please keep posting. We appreciate it.
Jessica, you mentioned something earlier about you like to partner with churches to help bridge that gap. And so one of the questions we had is, do you think it's the role of the pastor to counsel a member when it comes to emotional wellness, or is it just their role to be a part of the journey to
Mhm.
help them be a more productive in life?
I think that, and that's a really great question, because I think that sometimes we get pastoral counseling mixed up with mental health counseling, two total different things. But in the pastoral role, they are required to bring the word of God to the person and show them what the word says about them being whole and healthy from a pastoral perspective. But in that same breath, it's also the responsibility to connect that same person to resources that can further their journey. So they're supposed to be a part of the journey, but they're also supposed to provide their piece, because a lot of pastors tell me personally, this is not my area of expertise. I
Right.
will pray with my parishioner, and I will show them what the word of God says about, anxiety and depression and turning my mourning into joy, and then I'm going to send them to you. So I think that there's a pastoral responsibility to meet that parishioner where they are and do shepherd care, and then pass them along to someone who is equipped to address the higher level needs for mental health.
Again, everybody staying in their lane, right? Staying in their
That's right.
lane.
And we're like, we all collaborate. It's a collaborative effort. We all
Right.
work together, but everyone's working together in their own lane.
Would you go to your pastor if you were having some, I'm going back to diabetes. If you were having symptoms of diabetes, you're losing weight, your vision is blurred, you're urinating every 5 minutes, you might go to your pastor and say, "This is what's going on in my body." But what would your pastor say?
Go see your
Go see
doctor.
the
We'll
doctor.
touch and agree. We'll
Exactly.
touch and agree, and
Right.
thank God in advance for healing. And
Right.
now after I've done you go and you see a medical doctor
You do
first.
your part.
Same thing for emotional wellness.
That's it.
Absolutely.
Yeah.
That's
Yeah.
it.
But I think it's there's something about, especially when you talk about old school, because most pastors realize they're not a medical doctor, but when it comes to emotional wellness, I think we talked about this once before. Everything was pray about it, or let's cast that demon out.
Yeah.
So when you bridge that gap, see, I know most of us modern pastors are all for the mental uh emotional wellness. So I have people that I've been telling, call Carolyn, let me give you her number.
Thank you.
That's me. I know that's not my lane.
Yes.
You hang with me, you might be a little more messed up. But
Mhm.
but when it comes to older school, how do we get them? Because at this point we're dragging them.
Mhm,
Yeah.
mhm.
So
Mhm.
how do you bridge that gap?
So, in my experience, because in my experience, I've worked with multi-generational clients, in all different generations, and what I would say is conversations and being very respectful of their point of view while sharing information with them about some of the new information regarding what's happening regarding mental health. And so it's just a dance between respect of their views and their values and what they believe, but also like a presentation of new information. And we
Right.
all know that the brain can change. Neuroplasticity is a real thing. And when we present new information, that people's values and beliefs can start to um, allow that information to support what they already believe, and then
Right.
allow them to change and behave in different ways. That's what we do with therapy. That's really therapy.
Yeah.
So acting where they are, identifying what their values and beliefs are, and then presenting new information. That has always been a win solution for me.
Right. Because you have to be. It comes down to trust. I have to trust that you're not going to lead my congregants astray.
Mhm.
Right.
You're not
Right.
talking, you know, terms that I don't believe. You're not speaking against the word of God, that
Right.
you are speaking life as well as helping them to maneuver through life. And it comes down to conversation and trust. And then you have to look at a third, and a third. I learned this theory like years ago. There's one third that's going to jump on board instantly. The second third, you have to convince. And then there's going to be a third who's just not going to do it.
Right. Right.
So that old adage, when people get tired of being sick and tired, then they'll seek help. Because I have some primary care physicians who will send me clients, and especially elder clients, because they know they're not going to go on their own. But if their doctor who they trust says you need to go and see somebody, then I've had clients referrals that way. So we just got to keep doing these things like we're doing, keep having these conversations, get into the churches as much as possible, talk to the saints in and outside of church, and normalize being healthy. That's the bottom line.
So, ladies, we want to look at this question here from one of our audience, sister friends. So she says, "Hi, ladies. Thank you for this vital program and conversation. I'd like to get some advice on how we can help our sisters who silently deal with PMS-based mental hormonal problems."
That's a big one.
So, go ahead, Carolyn. I'll let you.
Oftentimes, this goes back to the microaggressions that women of color have to deal with. And I'm talking specifically about women of color, but it happens across the board, but not as often. The microaggressions that we suffer in the medical field. So if you say, I have severe cramps, or I get so sad, oh, it's just your hormones, eat some chocolate, that sort of thing. So this is where getting a match makes all the world of difference. If you're going to the gynecologist, and yes, women who are not sexually active can and should go to the gynecologist.
Yes.
Amen.
Young women should at some point go to the gynecologist. Even if you're saving yourself until you're married, God bless you, but it's just like going to the dentist. Go. So that's what I'm saying about normalizing healthcare. So if you find that you're suffering, or your child is suffering from these symptoms of mood swings and cognitive dissonance, and just off the wall kinds of behaviors, then realize this is not normal. Even though we've normalized it, it's not normal. And eating chocolate is not going to help. So this is when you go and seek a 2-4. You need a GYN who's going to address those issues and offer you some medical advice on how to curtail those issues, such as, I know some people were put on birth control pills to manage out their hormones. Once their hormones were at normal levels, they were taken off, and they were able to survive and have better periods and that sort of thing. But you could have an underlying depression, or have underlying depression that is severe, that shows up when your hormone levels change. Because that's what PMS is. Your hormone levels are changing. So, before I was a therapist, I say we put up with so much crap those other 3 weeks. That 4th week, we just need to take an L. Leave us alone. Because we leave me alone. I'm crazy. Leave me alone. But when you know better, you do better. No, babe, is your hormone levels dropping too fast, too slow, too fast, too low? So you need some assistance. And it could just be the diet. If you're eating a lot of processed foods, if you're not eating fresh vegetables, like we eat a lot of crap. And then if you're eating good stuff, there's not good stuff. So you may eat vegetables, but if you're eating a lot of vegetables full of chemicals, your body's reacting. It's a whole plethora of things. So if you're talking about getting healthy, then look at the whole gamut: a GYN, maybe a nutritionist, and a therapist. And you might need a psychiatrist, someone, or nurse practitioner, someone to prescribe you some medication. So, but that's having a team, a medical team to keep you well.
And can I just piggyback on it? Because that's so great, Carolyn. I was actually about to say, putting together your team and you specifically picking those people who align with your values. I know moms who do not want their children on certain medications and want a more natural route because of their youth. I have never diagnosed menstrual dysphoric disorder so much in my life. And what I've found myself, and it's called PMDD if you want to do some research. And PMDD is a diagnosis that's underutilized, and I think that we need to be paying more attention to it, because our young women are suffering at rates that they shouldn't. Historically, going back to the Black woman, historically, we have not been treated fairly in the medical arena. And so we have to do due diligence and do our own research. One thing that I do recommend my clients do is, as they are picking out their team, maybe it's an APN or a nurse practitioner, maybe it's a psychiatrist, their GYN, do some research on that person.
Absolutely.
Ask questions. And just like you would pick a therapist, they might not be a good fit the first time you meet them. But in addition to that, when you go to them, make sure you go to them with some data. So one thing that I make my daughters do, I have 3 teenagers. One thing I make my pray for me.
Just get ready to say that.
One thing that I do for my daughters is I had them when they first started getting their menstrual cycles, is start to track each day how they were feeling, and then as it got closer to their menstrual cycle, how they were feeling. I have 30 days worth of data, and you do that 3 months in a row. Then they start to say, okay, wow, I know what's happening. So why am I feeling so down and so sad? I don't want to see my friends. I don't want to do X, Y, and Z, because they do understand that now at day 17, I'm noticing day 17 this month and last month, I wasn't feeling like myself.
Right.
Talking about normalizing those terms.
Right.
But as mothers and as aunts and caregivers, it's our responsibility to educate them to know their body and to their own data. So when you're going to the doctor, we don't have these doctors, medical team members telling us what's happening with us. And I'm gonna say something else. Even for our young ladies who haven't yet got their periods, their menstrual cycles, but they are, approaching that age where they're closer, you'll start to see, hormonal differences up as well with them. And it's because their bodies are preparing. So that 9-year-old who got a lot of lip at different times of the month, or just seems to be not wanting to listen to anybody, take a step back. Could this be something that is physiologically based? Maybe because she's starting to act like this and starting to become more consistent. Let's take some data to our medical teams.
Wow. This is awesome, Wanda.
Yeah.
Thank you, Tammy, for that question. That was great. Great
Lady,
question.
can you just go over what does PMDD stand for again?
Premenstrual dysphoric disorder.
Dysphoric. Okay.
Yes, and it's really impacted many women, and there are different severities. You might get it mildly or moderately or severely. And we just need to be aware of, and you might not have it at all. Maybe you have a mild menstrual cycle, and your body doesn't respond that way. But that is just one thing to look at, because that research was referring to other areas you can look at.
Yeah, absolutely.
Wow. I wish that was around. We had that diagnosis when I was going through PMS.
It was around. It's just that we don't get those luxuries.
Right. You're right. Because I would, trust me, my mind worked crazy.
I know young women. I have 2 daughters, so I understand, but they're adults now, thank you, Jesus. But their friends would normalize having to be in bed for 3-4 days with cramp. Baby, that's not normal. It happens every month. You need to go to the doctor. Well, the doctor said it's nothing. Then you need to go to another one. So my thing now is I'm sending young women, go to a fertility specialist. Because they do a deeper dive into your blood work and the tests that they run, because of the nature of the beast. Like, you need to know, because having menstrual cramps that put you in the bed for 3-4 days is not normal.
Right.
Having
That's so true, Carolyn.
every month is not normal. It's not normal. You don't need a narcotic for something that's natural in your body. You shouldn't. I shouldn't say you don't. You shouldn't need a narcotic for a natural phenomenon. Right. So if something is not flowing the way it should, literally and figuratively, then you need to seek help.
Yeah,
absolutely.
When I think about it, because when we were young, that was quite some time ago. Most gynecologists were men.
Right.
So they thought our symptoms were in our head anyway.
Right.
So
and
now that we have
supposed to happen, you're a woman. It is.
Right. So now that we have so many women gynecologists, that's really what you said is just so good.
Yeah.
So good.
We have one last question, Wanda. I think pretty much there's a few more, but this question here, I don't think it's been addressed at all yet. And that is, I have a friend with an adult child that deals with anxiety. How do you determine what course of treatment is best? And does it always mean medication?
No, it does not always mean medication. Let's just preface that. You don't always have to have medication. However, if your child is an adult, let's just talk about adult people and their health. You can't force an adult to do anything. You can't
Right.
take an adult to the doctor. So if your daughter wants to find out what's going on with her, then you can be supportive of her and help her find a clinician, and then go to see if it's really anxiety, to find out what is going on, and help her understand why. Then after having talk therapy, she may very well need some medication to assist her. But I tell people all the time, medication is not the first recourse. It doesn't mean it's a death sentence, but I don't. I have a hard time with people not wanting to. What am I trying to say? Not willing. That's the part. Not willing to explore science for health.
Yeah.
I'm not saying you automatically take a drug. I'm not saying don't try the natural medication. Natural herbs, and I'm for all of it. But if something is bothering you and you can't get it cured on your own, then you need help.
Yeah.
Can I say something about that medication piece? Like Carolyn said, it is not our first recourse, right?
Right.
However, first of all, there are different severities to anxiety. Some people might have mild, just like the other disorder I named. It might be mild, it might be moderate. But when it starts to interfere with your daily life functioning or major life areas.
Yeah.
So, for example, it starts to change the way in which you interact with the people around you or your family members. This person used to want to go to social gatherings, but now they don't want to anymore. This child used to eat their food at dinner, but now they're picking. We have to be more aware of some of the signs, and then be able to attack those symptoms. But we also need to be willing to learn coping skills. I mean, I think that resilience is something that can be strengthened, right? But that resilience comes with working. And I think people think that going to therapy is, I go to talk to somebody, they sit in a chair, they listen to me, they give me some advice, which is not what it is. And I'm going to be all better. No, you're coming to therapy to put your stuff on the table. We're going to detail it, and then we're going to come up with strategies for you to put into action on a day-to-day basis.
Stress that part again, for you to put into action.
So you don't come to therapy for your anxiety. You have to go if you're not going to do the work. Mental health, going to see someone to improve your emotional wellness is work.
Yeah.
And so if you're ready to anything that you work, it will work it. You can work it if it will work. If you work it
will work.
So you have to put in the work. But I think that sometimes people like to go to medication because it's an easy way out. So they think a special pill will just help me to feel better. And we need to really think about what have we been exposed to increase our anxiety, to increase our fear, and then to address those things and then utilize coping strategies on a day-to-day basis. I was in before 2020, before the whole entire racial unrest revved itself up again, I never had a problem with the police pulling me over. And I'm just telling a personal story. What happened is when I would get pulled over, I would notice my heart beat start racing. I'm like, what's going on with my body? Because I started to recognize, wow, I'm having some anxiety over the cops pulling me over now. So be in tune with our bodies, just like we are with whether it's menstrual disorder, anxiety. We have to be in tune with our body, and when we identify changes, be ready to put the work in. It's not always medication, but medication can be explored if you are putting the work in and the results are not coming in a way in which they should.
Absolutely.
That's good.
I was
Thank you so
talking to
much.
medication because one of the viewers was saying that some medications cause depression, and that's goes back to having that medical team, that whole team, because your regular doctor can tell you it could be the combination of the medicines that you're on that causes this. So I think it's good that both of you mentioned having a whole medical team.
Yeah.
And can I say something? If somebody's ever concerned about whether or not a medication will be compatible with them, they can request for genetic testing that will be able to give them almost like a prerequisite to being prescribed the medication, to see if it's compatible with their body makeup. So you can get genetic testing to determine whether or not some of these medications are going to be effective or not. That's an option.
And if you can't afford it, or your insurance company won't pay for it, try out the medication. Make sure you're talking with the person who's prescribing it. Tell them what you don't want to see. I don't want to be in a coma. I don't want to walk around like a zombie.
Right.
And then try it out. If you are experiencing side effects that last too long, because sometimes anytime you take something new, you might feel something different for a minute. And remember, you need to have a therapeutic dosage. It's not going to happen one pill and I'm well. That's not going to happen either.
Yeah.
So work closely with your physician who's ever prescribing the medication and your therapist, because one doesn't knock the other out. Because psychiatrists, most of them will not give you talk therapy. They'll prescribe your medication, keep up with your blood work and all of that medical stuff, and then they'll send you back to a therapist. So just make sure, again, you have a team. And I'm going to say you need a team for everything. Seriously, your primary should be the head, and then you have your dentist, you have your, we're older. I got to have a cardiologist. I got to go and get that
pulmonary doctor, sleep study doctor. You name it, we got it.
And then I want you sending all of the reports back to my primary, because I'm going to talk to all of you. But when I go back to my primary, now we could spend a whole hour building insurance. I don't care. I need to know what I'm doing, how I'm doing it, and why am I doing it.
Right.
And I think that's exactly what you need with your therapist. What I'm doing, how I'm doing it, and why am I doing it.
Yeah.
I didn't know about the genetic testing that you could get done, but one of the things, because I'm a real advocate about medicines you put me on. So I found a site, I don't know if it was WebMD or one of them, but they actually, if you put in all of your medicines, they'll tell you which ones react with each other and what the reaction is. Not to mention, I'm reading all the side effects of every medicine. If you put me on a medicine, I need to know what it is, how it affects me, the side effects, all of that.
And those are conversations you should be having with your primary.
Right.
Your primary needs to know all of it.
And some of the systems now, because all of my doctors are linked together. So if one prescribes something, they all can see what it is.
That's it.
So, it's very important, exactly what you said. Yeah, I don't play with my health.
And any supplements that we take, if we're going to do a cleanse, or we're taking a detox, or, you're taking some vitamins and some herbs, it's all good. But everybody needs to know what's going on.
That's right.
Well, ladies, thank you so much. This was good information. Oh boy, we could have did a part 4, but we can't. But we will definitely have to have you back at some other time. We again appreciate you both. Thank you for your time.
And your time.
Yes. And please tell Mr. Kevin and Jessica, thank you for subscribing to the Sister Friend.
Oh, he's so supportive.
He is. That's awesome. Thank you. And thank you.
We appreciate it.
Again, and we want to have you just hold on for a few minutes backstage. We will definitely want to just thank you again. Okay. Stay with us.
Thank you for having us.
Thank you so much.
Oh, wow. Wanda.
We can't do a part 4, you sure? That is such vital information. Yes. And they dropped a lot of good nuggets, and the questions. Thank you, audience, for your questions and your comments. Those were really important as well, and they added to the conversation. So we want you guys to, we listed a whole lot of numbers where you can call to get help for whatever the situation might be, whatever you think it might be. So please jot those down. They're on the webpage as well, so you can always look them up again. But this information is vital, and we want to encourage every single one of you. If you're feeling some kind of way,
Right.
check your emotional wellness. Don't be ashamed. I've been to therapy. I've been to counseling. I'm ready to go again. Look, it is necessary because, like she said, sometimes you just need somebody to talk to who can understand what you feel.
Right.
You know, not only that, I have my sister friend who always checks on me. I must say I'm not as good as her when it comes to checking on people, but she checks on me regularly, and I appreciate that. So you got to have those kind of friends that you know love you and care for you and are concerned for you. And don't think everybody's just trying to get in your business. Sometimes we are legitimately concerned about each other.
Yeah, and most of the time we are concerned, but like you said, we can't. At some point, you got to put your guard down. At some point, you got to trust somebody. Find somebody you can trust, because it's all about your health and making sure that you live the life that you're supposed to live.
All right.
So here we are. So next month, we will be talking about growing older gracefully. We're going
maturing.
Yes, we're maturing. All right, whatever.
That was for some of the listeners. You know, everybody don't like that old
word. Listen, I'm all about the full truth. Okay. Oh, it's been great. We're gonna see each other real soon in person. So yeah, and matter of fact, Wanda, before we go, we have to remind our audience, and we'll post this as well. We may be in your area. So you got to come and check on some of my sister friends. If you want us to come in your area, please let us know. We might just show up.
That's right. Put on your best makeup.
Yes.
So of course, you know, it's that time of the evening where we have to bring it in, and we don't want you to end the conversation just because our professionals are no longer with us. The chat room will remain open so you guys can talk about it on your own. There was some good comments about somebody was saying how the doctor told her to ignore her daughter's behaviors. That's a mess, you know. Thank God she went and found another doctor that works. Please, ladies, don't be afraid to try your doctors out like you try out your dentist, like you try out clothes.
Right.
You know, whatever, find the one that fits. Find the one that fits. So, you know, we encourage you to, you know, always pray about it, but we encourage you to keep the conversation going. And we just want to make sure that you're having those conversations. So, sister friend, can we talk?
Sister friend, let's talk about it.
One another, talking about issues that we're all facing, good, bad, indifferent. Let's talk about it from one sister to another. Let's talk about it.